Hello everyone. In this lesson, we will learn what a systematic review really means, how students should plan and write one, and how tools such as Elicit can support the work. The most important message is that a systematic review is a research method, not simply a long literature review. It follows a planned, transparent, and reproducible process. AI tools may save time, but the student and supervisor remain responsible for the question, protocol, search, decisions, verification, interpretation, and final writing. This presentation has 6 goals. First, we will understand what a systematic review means. Second, we will plan the review before searching. Third, we will follow the practical steps from search to synthesis. Fourth, we will see which digital tools are useful at each step. Fifth, we will learn the structure of the final manuscript. Finally, we will discuss verification, research integrity, and responsible AI use. This is designed as a beginner-friendly overview, but postgraduate students should follow the higher methodological standard explained later in the presentation. A systematic review is a research study in its own right. Instead of collecting new data from patients or participants, the review team studies existing research. The word systematic means the team follows a planned method. The question is defined in advance, eligibility criteria are stated clearly, searching is documented, and every inclusion or exclusion decision should be defensible. The studies are then critically appraised and their findings are synthesized. A student should not call a paper a systematic review merely because many articles were read or because a Prisma diagram was added. Students often use the words literature review, scoping review, systematic review, and meta-analysis as though they mean the same thing. They do not. A narrative review gives a broad expert explanation and uses flexible methods. A scoping review maps the extent and nature of evidence, often when the question is broad. A systematic review answers a focused question using predefined methods. A rapid review deliberately shortens selected methods because a decision is needed quickly. Meta-analysis is only the statistical pooling step. A systematic review may have no meta-analysis if the included studies are not sufficiently comparable. Before starting, students should complete a feasibility check. The question must be focused enough to search and answer. A recent high-quality review may already exist, so the new work must justify an update in population, intervention, outcome, setting, or methodology. The team also needs sufficient primary studies, at least 2 people for independent review tasks, a suitable database and full text access, and enough time. A weak systematic review is not better than a well-designed scoping or narrative review. The review type should be selected honestly according to the aim and resources. This is the complete journey. First, define the topic and evidence gap. Second, frame the question. Third, write the protocol. Fourth, run the searches. Fifth, remove duplicate records. Sixth, screen titles, abstracts, and full texts. Seventh, extract the required information. Eighth, assess risk of bias or methodological quality. Ninth, synthesize the findings. 10th, write the manuscript. 11th, complete Prisma reporting. Finally, publish and plan updates if required. A single prompt to Elicit, ChatGPT, or Claude cannot replace these stages. The first task is not to write the introduction. It is to justify why the review is needed. Begin with a real uncertainty in healthcare, education, laboratory practice, or policy. Then search specifically for recent reviews and registered protocols. Record the date of this gap search. A new review may be justified because the previous review is outdated, used a different population, omitted an important outcome, excluded relevant study designs, or used weaker methods. Students should avoid vague statements such as very few studies are available without showing how that conclusion was reached. A clear question controls the whole review. PICO is commonly used for intervention questions. PO can be useful for exposure, risk, or experience questions. PCC is commonly used for scoping reviews. Each element must be operationally defined. For example, adult, structured education, usual care, improvement, and the acceptable follow-up period should not remain vague. These definitions later become eligibility criteria, search concepts, extraction fields, and synthesis groups. If the question changes repeatedly after the search begins, the review is at risk of selective decision making. The protocol should be written before screening and before the results are known. It explains exactly what the team intends to do. It includes the question, objectives, eligibility criteria, information sources, full search strategy, screening process, extraction fields, risk of bias method, synthesis plan, handling of heterogeneity, certainty assessment, and reviewer roles. Any later change should be dated, justified, and reported as an amendment. Eligible health-related reviews can be considered for prospective registration in Prospero. Registration improves transparency, but it does not mean that Prospero has peer-reviewed or approved the scientific quality of the protocol. A systematic search must be reproducible. Build concept groups from the question. Within a concept, combine synonyms with OR. Combine different concepts with AND. Use both controlled vocabulary such as MESH in PubMed and free text words. Database selection depends on the discipline. Health reviews may require PubMed or Medline, Embase, Central, CINAHL, PsycInfo, Scopus, or Web of Science, depending on the question. Trial registries, grey literature, reference lists, and citation searching may also be important. Save the exact search, platform, date, fields, filters, and number of records. Google Scholar or Elicit alone should not automatically be treated as a complete systematic search. Different tools solve different problems. PubMed and other databases retrieve records. Prospero helps identify ongoing reviews and register eligible protocols. Zotero manages references and citations. Elicit assists discovery, screening, and extraction. Rayon or Covidence organize review decisions and collaboration. Design-specific instruments support risk of bias assessment. Raveman or other statistical software may be used for meta-analysis. ChatGPT or Claude can help explain methods, organize templates, simplify language, and audit a verified evidence pack. No tool should be asked to independently decide the final evidence base and write an unchecked manuscript. Elicit currently provides a guided systematic review workflow. The team can enter the question and protocol context, gather papers, screen titles, and abstracts, optionally screen full text, extract data into structured columns, export tables, and generate a research report. Semantic search is useful for exploration and finding conceptually related papers. Keyword search allows Boolean strings and is more suitable when reproducibility is required. Elicit can also accept uploaded or imported records. These functions can reduce repetitive work, but they do not remove the need for external database searching, independent reviewer decisions, and source verification. This slide gives the practical Elicit sequence. Start a systematic review and enter the exact question. Add protocol details, including eligibility criteria. Choose such sources carefully. Import records found elsewhere when required. Review the suggested screening criteria before using them. Human reviewers must confirm decisions. Enable full text screening when the abstract is insufficient. Create extraction columns with clear instructions, allowed answers, units, and time points. Open the paper and verify every extracted value. Export the screening and extraction tables. Treat the generated report as a starting aid rather than the final manuscript. Elicit cannot safely replace professional search planning, complete database coverage, independent human screening, source verification, risk of bias judgment, statistical interpretation, or author accountability. The safest pattern has 4 parts. First, AI proposes an answer. Second, a researcher checks it against the protocol and original source. Third, a second reviewer confirms important decisions or data. Fourth, the team records what was accepted or changed. This human in the loop process should be written into the protocol and the AI use statement. Screening occurs in stages. At title and abstract screening, remove clearly irrelevant records but carry uncertain records forward. At full text screening, apply all eligibility criteria and record one primary reason when a study is excluded. Multiple publications may describe the same underlying study and must be linked rather than counted as separate studies. Important screening decisions should be made independently by 2 reviewers. Disagreements are resolved by discussion or a third person. Keep exact counts because they will be reported in the Prisma flow diagram. The extraction form should be designed and piloted before extracting all studies. It normally includes citation details, study design, setting, eligibility, participant characteristics, intervention or exposure, comparator, outcomes, time points, numerical results, analytical methods, funding, and conflicts. Each numerical field should define the expected unit and format. In Elicit, create detailed columns rather than asking vague questions such as, what were the results? Every important answer should be linked back to the full text page, table, or figure. More than one person should extract or independently verify important data because extraction errors are often difficult to detect later. Critical appraisal asks whether the study methods could systematically distort the results. The correct instrument depends on the study design. ROB2 is used for randomized trials. Robbins 1 is used for non-randomized intervention studies. Quadas 2 is for diagnostic accuracy studies. AMSTAR2 or ROBIS may be used when appraising systematic reviews. Other study designs require an appropriate validated checklist. Do not choose a tool because it is easy. Do not convert every checklist into an arbitrary numerical score unless the instrument specifically supports it. Record the judgment and the evidence supporting it. Synthesis begins by understanding whether the studies are sufficiently similar. Narrative synthesis organizes the evidence into meaningful groups and compares the direction, magnitude, consistency, and limitations of findings. It should not simply count how many studies were statistically significant. Meta-analysis can be used when the studies measure compatible questions and outcomes. The team must select an appropriate effect measure, model, and method. Examine heterogeneity and perform only justified subgroup or sensitivity analyses. Statistical pooling is not a compulsory sign of quality. An invalid pooled estimate can be more misleading than a transparent narrative synthesis. The manuscript should be written after screening, extraction, appraisal, and synthesis are complete and verified. The title and abstract identify the work as a systematic review. The introduction explains the problem, previous evidence, and review objective. The method should be detailed enough for another team to understand and reproduce the process. The results report the study flow, study characteristics, risk of bias, and synthesis. The discussion interprets the evidence, addresses limitations, and compares the findings with prior knowledge. The conclusion should not be stronger than the evidence. Every result statement must be traceable to an included study or analysis. PRISMA 2020 is the main reporting guideline for systematic reviews. Its checklist covers the title, abstract, introduction, methods, results, discussion, and other information. The flow diagram reports how many records were identified, deduplicated, screened, excluded, and included. PRISMA P supports protocol reporting, and PRISMA SCR supports scoping review reporting. PRISMA should be used throughout manuscript preparation. However, it is not a method for conducting the review and cannot make a limited search or biased screening process systematic simply because the checklist and flow diagram were added. ChatGPT and Claude are useful for explanations, structure, templates, checklists, consistency checking, and language improvement. They can help convert an approved protocol into a workflow, create extraction instructions, audit tables, and simplify verified writing. They should not be trusted to invent the gap, generate unverified references, claim searches were run, make final inclusion decisions, extract unchecked numbers, choose unsupported statistical methods, or overstate conclusions. A strong prompt should restrict the model to the supplied evidence and require it to mark unsupported statements for verification. Responsible AI use requires human accountability. The authors remain responsible for every method, decision, reference, and conclusion. Confidential or identifiable material should not be uploaded without appropriate permission and safeguards. Generated claims, references, quotations, and numerical values must be checked against the original sources. Keep an AI use log recording the tool, date, purpose, stage, and verification method. Follow the university and target journal policy. The disclosure should be specific rather than simply saying AI was used. AI tools cannot accept responsibility and therefore cannot be authors. These are common reasons why student reviews become unreliable. A review may be incorrectly labeled, started without a protocol, based on a single search source, completed by one person without verification, or altered after the results are seen. Students may also use an unsuitable appraisal checklist, force incompatible studies into a meta-analysis, accept AI-generated references or numbers, and write conclusions that imply causation or certainty not supported by the evidence. The supervisor should check these risks at planned milestones rather than only after the manuscript is complete. The minimum standard depends on the degree, level, and feasibility. Undergraduate students may benefit more from a well-scoped evidence review, scoping review, or structured review than from an incomplete systematic review. The learning goal should include transparent searching, screening, extraction, and appraisal. Postgraduate systematic reviews should normally have a prospectively prepared protocol, comprehensive and reproducible searching, independent study selection, verified extraction, formal risk of bias assessment, justified synthesis and full reporting. Research support should teach and audit the method. It should not replace the student's intellectual work or write an unverified manuscript on the student's behalf. This checklist can be used as a supervisor checkpoint. Before writing the manuscript, the team should have an approved question, a justified gap, a dated protocol, complete search records, deduplication documentation, independent screening, full text exclusion reasons, a piloted extraction form, verified data, risk of bias judgments, and a completed synthesis, Prisma reporting, reference verification, AI used documentation, and final supervisor QC should also be completed. The simple sequence is evidence first, tool second, and writing third. To conclude, a systematic review is defined by its methods rather than by its length or appearance. Plan the methods before seeing the results. Search transparently, use independent human screening and verified extraction, use illicit and language models to accelerate structured tasks, but retain human responsibility. Conduct meta-analysis only when it is justified. Use Prisma to report what was actually done. Most importantly, make every claim, citation, and numerical result traceable to the underlying evidence. The next practical exercise should apply this process to one real student topic. These are the main authoritative sources used to prepare this training. Students should consult the current Prisma resources, the relevant Cochrane or JBI methodology, Prospero guidance, official illicit documentation, and the official documentation for each software tool. The deck is an orientation resource and not a substitute for topic-specific support from a supervisor, information specialist, methodologist, or statistician.